Well, May is just 2 days away, and we wanted to take the opportunity to help promote May as Stroke Awareness Month and provide you with information on how to take part in a stroke walk. Joining us is Casey Grimmett, the stroke coordinator with Baptist Health. Casey, thank you so much for being here today.
Thanks for having me.
Yeah, really excited to talk about this walk, but first of all, why is this so important to recognize May as Stroke Awareness Month?
So in the United States, a stroke occurs every 40 seconds. That's about 800,000 people per year. And so we find it really important to for people to know what the signs and symptoms of stroke are. That's the main focus, is to raise awareness for what stroke looks like and then what treatment is available for stroke. And so that's what we try to get out and do in May, is let everybody know what stroke is and what those signs and symptoms are.
Yeah, we have this great graphic up right now, so let's walk through of recognizing what a stroke looks like.
So we use the BFAST scale to identify signs and symptoms of stroke. B stands for balance, and so this is sudden onset dizziness or difficulty walking. E is eyes. Stroke can make your eyes do a lot of funny things. It can make you lose vision, specifically in the periphery of your vision. It can also make you look only in one direction. And so if you see somebody that is just, we call it gazing to one side, that could be a sign of stroke. F is facial droop, and this is simply asking someone to smile. And if one side of their face is slightly lower than the other, that could be considered a sign of stroke. A is arm. This could be arm or leg weakness or numbness. Sometimes this happens in just an arm. Sometimes this happens in just a leg. The classic symptom is arm and leg on one side. And then S is speech difficulty. And so this could look like somebody with slurred speech, but it could also look like a person that's having difficulty finding their words or even following directions. And so a lot of times this looks like confusion. And so we should consider acute onset confusion a sign and symptom of stroke. And then T stands for time. You lose 32,000 brain cells per second of an acute ischemic stroke. And so when these symptoms happen, you should call 911 immediately so that you can come to the hospital and hopefully receive treatment.
Now, would someone have all of these signs or even just maybe one sign?
No, it could just be one.
Okay.
It could be a few. It could be many. And stroke presents itself in many different ways, and that's one of the reasons why it's difficult to identify stroke. But the BFAST scale makes it a little bit easier to identify that pattern. So it could be one, it could be many symptoms.
Is there anything we can do to reduce our risk of a stroke?
Absolutely. So in Arkansas, we live in what's called the stroke belt. And the stroke belt is known for its highest incidence of stroke and also mortality, but it's also known that the risk factors that we have in the state really contribute to our overall risk of stroke. And so high blood pressure is one of the most preventable risk factors of stroke. In fact, it's number one. Some things that we can do to prevent it is just regular screenings with your primary care physician. So keep those appointments that you go to every year. Check your blood pressure regularly. Some other things to be aware of are things like diabetes and high cholesterol. Those things also contribute to our stroke risk, and that's also something you can address with your primary care physician when you go and see them yearly. And so keeping those appointments is really, really important.
Well, at the beginning, we mentioned that there is a stroke walk. This is the first one at Baptist. What do we need to know?
So this is the inaugural stroke walk. It's something that we are really, really excited about. This is going to happen on Friday, May the 16th from 10 a.m. until 2 p.m. This is kind of a drop-in thing. So it's about a 2-mile walk. It's going to be hosted basically in the garden at Baptist in Little Rock. That's right in front of the main entrance. And so the start line and finish line will be there. We'll have lots of events going on. We have an inflatable brain that's kind of interactive. Our community health screening bus is going to be out doing those screenings that we just talked about, being high blood pressure and blood sugar and things like that. And so you can see the map here. The X marks the spot, right? So that's the starting point, and we'll go around the hospital. About 2 miles. And so we're really excited to not only raise stroke awareness, but also celebrate stroke survivors and then commemorate those that we've lost to stroke. And so we're excited to celebrate with people in our community.
What are you hoping to accomplish with this walk?
Overall, we want to raise stroke awareness. We've talked about that. But we are also trying to prevent stroke. And so one of the ways that we're doing this is raising money to purchase blood pressure cuffs for people that are at high risk of having a stroke. We said high blood pressure is the number one preventable risk factor. And so we're trying to get ahead of it and prevent stroke. So we are accepting donations. We will have cash and card payments available. And that's what that money will go towards is hopefully keeping people from having a stroke in the first place.
Is there a goal that you would like to reach of how many you would like to get?
Yeah, so we're trying to raise money to purchase 300 cuffs for now, and we're really, really close to that. So we're excited to be able to provide something to our community, raise stroke awareness, and celebrate survivors at the same time.
Perfect. And we did have the QR code up, but again, for people to register, what's the best way to do that?
So you could scan the QR code, you go to the Baptist Health website and search for Stroke Walk, or even simply Google Baptist Health Stroke Walk and it will come up. And you just put your information in there. It is free and open to the public. We will have things for kids. We will have things for everybody just to celebrate and have a good time.
Perfect. Casey, anything else that we should know about this walk?
No, I think that's it. We would love for you to join us. It's going to be a lot of fun. And so we'll see you on May the 16th. And you can also call our health line. That's 1-888-BAPTIST. Or visit our website, baptisthealth.com.
Perfect. I know it's going to be a great success. Thank you
you
so much for your time.
Yep.